Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She is the Research and Technical Director of the Institute. How are you, Doctor? How you doing?
Hi, Louise. I'm really well. Always happy to be with you. Thank you.
We do have some exciting news for you, but today we're going to talk about neurological diseases with Dr. Figueredo. Doctor, can you mention some of those neurological diseases?
Yes, absolutely. A lot of patients are probably, or a lot of listeners are probably wondering what we mean when we talk about neurological diseases or conditions. So basically, a neurological disease or condition is anything that will affect the central nervous system. So that could include the spinal cord, the brain, the brain stem. So usually when we talk about neurological, that's what we're talking about. So any defect or disease condition of that part of the body that results in secondary symptoms is what we mean by neurological diseases, such as Parkinson's disease, Alzheimer's, multiple sclerosis. I think in some schools, even autism spectrum disorder is considered by some a neurological disease or condition. We at the Stem Cell Healing Institute actually consider it a neurodiversity. We don't really consider it a disease. However, we do also acknowledge the fact that there are a lot of children and people on the spectrum that just need to lead a little bit more of a normal life. And there are some things that are simple for us on a day-to-day basis that aren't so simple for children and people on the spectrum, the ASD spectrum. So in that case, we are always trying to help. However, we don't consider it a disease at all. But these are the types of conditions that we talk about when we talk about neurological diseases.
So we can say like multiple sclerosis, like a stroke, or those are neurological diseases, right?
That's right. That's right. We can also put them under the category of neurodegenerative diseases, also in certain conditions. Yes.
To treat those neurological diseases will be the same treatment as the spinal cord.
It depends. It depends what the disease is, where the damage is, where it's starting, what's the primary cause. Is it autoimmune? For instance, so multiple sclerosis, Parkinson's, those are neurological conditions that are also autoimmune, where the body is creating antibodies that attack itself. And so in this case, we have to get really specific and pinpoint where we're going to start with treatment. Okay, is it the immune system? And in fact, our goal in treatment is two-pronged. We have to consider approaching it in two ways, not one exclusive than the other. Okay, so for instance, with multiple sclerosis or Parkinson's, which are both neurological and autoimmune, we have to not only shut off the autoimmunity, okay, where the immune system is concerned, and shut off those antibodies, but we also want to undo the damage done by the antibodies. So when the antibodies, for instance, in multiple sclerosis, when the antibodies attack the myelin sheath, the fatty coating on our nerves and neurons, and that is being degraded by these antibodies, we need to regenerate that myelin and also shut off the autoimmunity so we don't regress after we've made some progress. And so in so many cases, for instance, with multiple sclerosis, we put patients in remission, and because we've shut off the autoimmunity and shut off the progression of the disease while regenerating the myelin sheath of the nerves, and looking to again put in place the any deficit that has been implemented from the attack on the myelin sheath. We try to undo that deficit, undo that damage, so that we get more mobility, swallow better, eat better, using their limbs better. So that's what we look for multiple sclerosis, for instance.
I see, doctor. And I know depending on the condition, the symptoms may vary, but what are some of the symptoms we can find for any neurological disease?
Yeah, so anything cerebral is usually where it begins. Many, focus, concentration, memory, speech, mobility, with so many conditions, right? Parkinson's, multiple sclerosis, Alzheimer's, they all get affected. The ability to eat and chew and swallow food, for instance, breathing, the voluntary and involuntary muscle contraction. So all of these can be affected, and depending on the degree of progression, and how fast the disease is progressing, the stage at which they've progressed. There are different symptoms, and so we're always trying to undo the damage is the goal, and then to keep the progression at bay.
Excellent, doctor. Are the neurological diseases affect anyone at any age, or
That is a super question, Louise. So there is depending on the condition, there can be genetics involved. A lot of times it's the environment, nature versus nurture, and what's going on. So yes, in sometimes autoimmunity begins from no reason whatsoever. There's no rhyme or reason. It doesn't run in the family. There's no genetic component. But there have been theories. One of my theories is that when there's a chronic condition, some kind of, it could be even the common cold or the flu, or an immune system, that someone that's constantly getting sick. And when there's this chronic picture, or a chronic stress, it creates sort of a mutation, for lack of a better word, and that can cause the immune system to sort of, okay, say, and just kind of trigger an autoimmunity, for instance. And so that is something, an occurrence that can trigger a neurodegenerative or neurological disease. We don't only want to undo the damage that's been done. Okay, that's almost the easy part. Because we know stem cells can regenerate damage. We know stem cells can regenerate nerves and tissues and various parts of the body. But we also need to shut off any sort of trigger of that damage. And so that's what we're accomplishing, and that's what we do accomplish. So our goal is to accomplish that, and that's what we do accomplish. Um, and so what we try to do is we will apply the stem cells intravenously, and because the condition is usually stemming in the brain, we in the central nervous system, we will apply mannitol, which is a natural sugar, to allow the stem cell to penetrate the blood-brain barrier, as well as an intranasal aspiration, which again, the stem cells get directly past the blood-brain barrier and into the central nervous system. And thirdly, leaving no stones unturned, we will also apply the stem cells intrathecally, which is directly into the cerebrospinal fluid, in order for those stem cells to bathe the brain and the spinal cord and the brain stem, and everywhere we want the stem cells to be. And then lastly, if we have any sort of deficit, like locally, the legs or the arms, or somewhere where we can also inject the stem cells locally to sort of enhance that area and promote healing and decrease any deficit, we will do that also.
so for many of these patients we can actually say that we can improve the quality of life, also avoid surgery if that is the case.
Absolutely. We're looking to avoid any sort of hardship, and that's the goal, is to improve quality of life. The patient can eat and swallow again. The patient can move around. The patient can, memory and speech improves. There's so many, there's so much room for improvement with these kinds of conditions with stem cells. So it's a very, very rewarding task.
And stem cells can reduce overall inflammation as well, right?
That's
There.
absolutely correct. And yes, and so many of these conditions, I'm glad you mentioned that, because so many of these conditions, almost every condition that we speak about, is inflammation is either a huge cause or a huge part of the picture or a result of. And there's almost no one that doesn't have some degree of inflammation. And and especially in these types of conditions, yes, we have a very big inflammatory picture.
So it is very clear the approach that you're going to take with these patients, doctor. But do you include anything else in this treatment?
Yes, absolutely. As I've mentioned in past podcasts, and most listeners who have heard me speak before probably already are aware that it's very, very comprehensive in our approach. And I mentioned part of it already for neurological and neurodegenerative conditions, where we do the IV with mannitol, intranasal aspiration, intrathecal, any local injections if necessary. And then we round this out really well with a total detox program, a nutritional IV with key antioxidants, minerals, vitamins. We follow that up with natural organic suppositories that work with the portal circulation for the best detox with the liver and the gut, and as well as B vitamin shots. And then we also do age appropriate growth hormone therapy. We also do oxygen therapy, and that would be in the form of exercise with oxygen or hyperbaric oxygen, depending on the limitations of the patient, as well as a personalized stem cell enhancement formula, which is a proprietary blend of herbs, minerals, key minerals for just to keep the stem cells going. And then, of course, we don't negate or ignore our psychological, emotional, even spiritual well being, because in healing, that is so important. Having a certain frame of mind, a certain attitude. After, we see patients that have suffered for so long, they don't even know how to feel well anymore, or if it's even possible. So we never ever ignore that aspect of a patient's well being, because our complete well-being is not only our physical body, it goes way beyond that. And so we make sure to address that also and not ignore that aspect of life.
Thank you, doctor. So, like I mentioned in the beginning of the podcast, we do have a new website. So please visit our website and you can see the new platform that will be stemcellhealinginstitute.com. Doctor, can you tell us how the structure is now in the website so the listeners can know what to look for?
Yes, thank you, Louise. Thank you for mentioning that. So we have a brand new revamped website with more videos and up-to-date videos, up-to-date and ongoingly updating the articles, as well as videos and testimonials, and a whole bunch of new things that we're currently updating and ongoingly updating. And just we're really excited. We're really excited about it. So we have that going with our website, as well as YouTube, Instagram, Facebook. We have new shorts that we're adding, and then our ongoing podcasts as well.
So we do have a monthly newsletter now in place, right, doctor? In case they want to join.
Yes, yes. So members and subscribers to the website will be entitled to course, free of charge monthly newsletter. We may even do them more often than monthly, but a newsletter that keeps you, our listeners, abreast of the latest research, our latest procedures, and anything else we feel is relevant and that would interest our listeners.
Okay, thank you, Dr. Brady. In case you have a private question for the doctor, you may reach her at info@stemcellhealinginstitute.com. And thank you, doctor. I don't know if you want to add something else to this podcast.
No, I think it's pretty complete. We've done our job, I think.
Okay.
All right.
Thank you very much.
Thank you, Louise. You have a good one. Bye-bye.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo, that is on YouTube. Thank you.